Magandang medbuhay po sa inyong lahat. Ako po si Gia.
Magandang medbuhay sa mga manonood dyan. Ako naman po si Sean. Magandang medbuhay sa iyo, Gia.
Magandang medbuhay din sa iyo, Sean. Kamusta naman? May panlasa ba tayo dyan?
Siyempre naman, ngayon na may pandemya, sinisigurado ko ang aking pamilya ay safe.
Mabuti naman at ganon. Dapat talaga ay lagi tayong mag-ingat. Lalong-lalo na sa mga nanonood ngayon, magdoble ingat po tayong lahat. Ugaliin mag-sanitize ng ating bahay at ng ating mga sarili, lalo na pag galing tayo sa labas. O siya, huwag na tayo magpatumpik-tumpik pa. Ngayon pong araw na ito ay pag-uusapan natin ang isang specialization ng mga doktor na makakasama natin today. And of course, tungkol pa din ito sa ating system at meron tayong specific topic na i-share ng ating magiging guest today na si Matthew. Siya ay 7 taong gulang pa lamang kaya kasama niya ang kanyang mami na si Mami Julie. Hello po!
Magandang araw po.
Magandang araw naman po sa inyo pati sa mga nanonood.
Good day, Mami Julie and Matthew. We are pleased to meet the both of you. Can you tell us about what illness Matthew have? And of course, share something of his experience and such.
Ako po si Matthew, 7 taong gulang. Meron po sakit na tinatawag na acute glomerulonephritis.
Opo, anak ko po si Matthew. Nung una akala ko po wala lang. Nakuha niya lang yung nararamdaman niya sa paglabas-labas niya ng bahay. Kaya inobserbahan ko po muna siya. Kaso habang tumatagal, lumalala ng lumalala. Kaya nag-decide na din po kami siyang ipa-check up sa doktor.
So medyo makulit na bata pala talaga tong si Matthew. Laging nasa labas. So, given the situation back then, pwede mo ba naming malaman kung ano yung mga symptoms bago siya ma-diagnose ng AGN?
Ganito po kasi yun. 10 days po bago siya i-admit, may pinakita po siya sa aking mga tumutubong rashes sa left leg and ankle area niya. Medyo nakakadiri po kasi may mga nana na lumalabas. Tapos po, namamaga din po siya ng konti. Tapos nung pang 7 days po niya, na dinala ko po siya sa clinic na malapit dito sa Navotas. Minigyan lang po kami ng amoxicillin, kaso hindi ko po siya napapainom on time.
Okay po. So, the prescribed medicine was irregularly taken pala.
Ano pong nangyari few days after kay Matthew?
2 days po bago po mai-admit si Matthew, nakaramdam po siya ng sakit ng tiyan, tas pati po yung sakit sa balakang, nararamdaman niya din po. So yun, tinuloy na lang po namin yung pag-inom ng gamot, yung antibiotic niya, tsaka po kung saan yung may masakit, wina-warm compress na lang din po namin. So nawawala naman daw po ng konti.
Grabe naman pala ang mga symptoms na naranasan ni Matthew for his age.
Opo, hindi pa din po doon natapos yung experience ni Matthew eh. A day before po, bago siya i-admit, wala na po siyang ganang kumain. Tapos masakit po yung ulo niya. Tapos nag-aalala na po ako kasi yung ihi niya po, nag-iba din yung kulay. Tapos yung naman po, yung few hours na lang, i-admit na siya. Napansin po namin, kakagising niya lang, namamaga po yung mukha niya tsaka yung sa ankle niya. Tapos yun, nag-decide na po talaga kami na siya dalhin sa ospital. Ang sabi po ng doktor, yun nga po, meron siyang acute glomerulonephritis.
Oh, I can feel the pain by just listening to your story, Mami Julie. Matthew was so brave to overcome those painful moments.
Indeed, Sean, you're so brave, Matthew.
Thank you po.
Thank you for sharing to us your condition, Matthew. As part of this program, I am very excited to introduce to you our professional doctors that will surely help you regarding on your condition.
Yes naman, kaya for the viewers na merong kondisyon gaya ng kay Matthew, stay tuned and keep on watching. Magbabalik po ang aming programa pagkatapos ng isang short commercial.
Feeling low on energy? If you find yourself feeling sluggish,
Having difficult staying awake, or drinking multiple cups of coffee just to make it to lunchtime, you're not alone. While you might think reaching for a Starbucks or Red Bull is the answer, there are some better ways to enhance your energy levels naturally.
Stay hydrated. Drinking enough water is incredibly important for several aspects of health. One of the first symptoms of dehydration is feeling tired. When you are low on fluids, your body may feel tired and weaker than usual. Consuming a sufficient amount of fluids will help replenish the water your body loses throughout the day and can help you maintain your energy. Eat a nutritious diet. Following a well-rounded diet can not only reduce your risk of several chronic conditions but also significantly affect your energy levels. Choosing whole, nutritious food can provide your body with the vitamins and minerals it needs to function at its best. On the other hand, eating lots of processed foods that are high in sugar and fat can negatively affect both your energy levels and your overall health.
move more. Regular exercise important for reducing your risk of chronic diseases, including heart disease, type 2 diabetes, and obesity. What's more is exercise a natural energy booster because whenever you do it, oxygen-rich blood surges to your body, to your heart, muscles, and brain. Get enough sleep. Not getting enough sleep can drain your energy levels, leaving you feeling lethargic, grumpy, and tired the next day. Although the amount of sleep per person needs can vary slightly, experts generally recommend aiming for at least 6 to 8 hours of sleep per night to boost energy levels and support overall health.
Sounds good, right? Fortunately, there are plenty of healthy action that we can take to reduce fatigue and boost our energy levels. When we live in a healthy lifestyle, our body remains healthy and our mind stay intuitive and fresh. I hope this short video will help you to live better lifestyle. Ating tandaan na dito sa magandang medbuhay, kami ay may care sa'yo.
Ayan, at natapos din ang ating commercial. Sana may natutunan kayo mga viewers. So ano pang hinihintay natin? Let's all welcome our pediatric nephrologist doctors na naglaan ng kanilang oras para makasama sa ating program today. Magandang medbuhay sa inyo, Dr. Martinez, Dr. Argante, and Dr. Purungganan.
Hello to all viewers. Magandang medbuhay po.
So, doctors, kumusta naman po?
Eto, mabuti naman.
Still alive and still kicking.
Eto, may panlasa pa naman siya.
Oh, our doctors are lively today? Okay, so, I assume na aware na po kayo sa kondisyon ni Matthew at alam po naming expert kayo sa field na yan. Maaari nyo po bang i-explain sa amin kung ano talaga ang sakit na AGN at kung paano ito na-acquire, mga doc?
Of course, Sean, we're already aware and we're here to inform you guys what AGN really is. So basically, acute glomerulonephritis is a common condition in childhood. It is defined as those glomerular diseases that may present with an acute nephritic syndrome, which is characterized by sudden onset of gross hematuria, edema, hypertension, and renal insufficiency. Glomerulonephritis, also referred to as inflammatory condition of the glomeruli, which are the tiny units within the kidney that filters blood. Ang kidney kasi natin is made up of approximately 1 million glomeruli. Glomeruli remove fluids, electrolytes, and waste from the bloodstream. If the glomeruli are damaged, it can disrupt the function of the kidney, leaving it unable to remove waste and excess fluid efficiently. As a result, dangerous levels of fluid, electrolytes, and wastes can build up in the body. This can lead to complications such as acute kidney failure, high blood pressure, and chronic kidney disease.
Yes, Dr. Purungganan is correct. Glomerulonephritis can be both acute and chronic, which develops gradually over several years. Either type can be fatal. There are certain illnesses that are known to trigger acute glomerulonephritis kasi. The conditions that can lead to an inflammation of glomeruli include strep throat, immune diseases such as lupus, Goodpasture syndrome, a rare autoimmune disease in which antibodies attack your kidneys and lungs, heavy use of nonsteroidal inflammatory drugs such as ibuprofen and naproxen, or it may be due to problems with your immune system overreacting to the infection. This can go away naman without proper treatment. If it doesn't go away, prompt treatment is necessary to prevent long-term damage to your kidneys. Sa case ni Matthew, acute pa lang naman so it can be temporary and reversible. Most typically, the child with AGN will be seen because of the sudden development of change in their urine color, which is caused by bleeding in the kidneys. Hematuria in children with AGN is typically described as coke, tea, or smoky colored. This condition can also lead to urine retention, causing puffiness in the face and less frequent urination. Water and salt retention caused by this may lead to high blood pressure, as well as swelling in the ankles and feet. Children with severe inflammation due to this may also feel tired. They may also have dry and leechy skin and experience muscle cramps at night. If this is left untreated, this condition will likely lead to severe kidney damage, kidney failure, and end-stage renal disease that may eventually require dialysis and a kidney transplant.
So it's a good thing naman pala at napacheck up agad si Matthew at nalaman na may acute glomerulonephritis siya, no?
Anong good thing doon, Gia? Paki-explain.
Don't get me wrong, okay? What I mean is, maganda na nalaman agad nila yung sakit ni Matthew dahil acute pa lang to and mas malaki yung chance na gumaling siya kung may iwasan yung mga nagkakos nun. And I'm just relieved na hindi siya chronic, ano.
So bagay, good point. So, Doc Arrogante, paano po ba nadadiagnose ang AGN?
So, the AGN can be diagnosed through performing blood and urine tests to determine how well the kidneys are working. Then the samples will be sent to a laboratory for analysis. A creatinine clearance test compares how much creatinine, a waste product that is formed as a muscle tissue breaks down, is eliminated in urine versus how much remains in the blood. When the kidneys function normally, more creatinine is found in the urine than in the blood. A blood urea nitrogen and serum creatinine test reveals how much the urea nitrogen and creatinine substances is formed by the breakdown of proteins such as albumin are in your child's blood. Higher than normal levels of these substances are a sign of poor kidney function. Doctors also perform tests to detect red blood cell cast, which are cylindrical structures. These develop when the glomeruli bleed and are often seen in the urine of people with glomerulonephritis. Testing can also determine if autoantibodies are present. These proteins which attack healthy tissue instead of bacteria and viruses may be found in the blood when a child has a glomerulonephritis as a result of an autoimmune disorder. Meron din tayong tinatawag na kidney biopsy. A kidney biopsy is often recommended to confirm that a child has a glomerulonephritis, especially if the laboratory tests reveal the presence of red blood cell cast or autoantibodies. This procedure is usually performed in the hospital. The doctor first numb a small area of skin on the child's back with a local anesthetic, then guided by an ultrasound device that they will insert a thin needle into the kidney to remove a tiny amount of tissue. So, the tissue sample is sent to a laboratory where a pathologist, which is a doctor who studies disease at a cellular level, determines whether it is inflamed and to what extent.
Thank you so much po sa kasagutan, Dr. Arrogante. Meron na lang po akong last question sa inyo mga doc. Ano po bang pwedeng gawin ni Matthew upang siya po ay gumaling? And I'm sure meron din tayo mga viewers ngayon na gustong malaman kung paano makakaiwas sa sakit nito. How can AGN be prevented?
As for Matthew, gaya ng sinabi ni Doc Martinez, acute pa lang naman ito, so it can be temporary lang. Pwede siyang resetahan ng doktor niya ng antibiotics to kill the pathogens that is causing the infection. Pero I think the best way to recover from it and prevent future episodes is to control his blood pressure, especially if it is the underlying cause of his condition. He should also restrict the amount of salt, protein, and potassium in his diet. This may minimize the fluid retention and swelling of his face and ankles.
Kaya nga, prevention is best when kidneys are kept in healthiest way possible. The best way to do is to drink plenty of waters each day. We recommend you guys to drink at least 6 to 8 glasses of water daily. Also, proper diet is important in keeping kidneys at their best. A diet low in sodium puts less strain in the kidney's filtration system. A diet low in cholesterol aids with kidney function. And also, it is important to keep one's blood pressure within a normal range. That's it.
Ayan, maraming salamat po sa very accurate na information mga dok. Sa mga manonood dyan, sana po ay may natutunan kayo. To Matthew and Mami Julie, again, we thank you both for letting us know about your condition live on television. At muli, sa aming pagtatapos, humihingi din po kami ng taos-pusong pasasalamat sa inyo, Doc Puruganan, Doc Martinez, and Doc Arrogante.
Para po sa pagtanggap ng aming pananyaya sa kaalaman ng ating mga mamamayan, mabuhay po kayo. Maraming salamat.
Maraming salamat din sa inyo. Hiling namin ng mabilisang recovery mo, Matthew.
At dyan na po nagtatapos ang ating programa. Muli, magandang nagbuhay, viewers.